we're created a platform so 30,000 zip codes across the country can enter their zip code, take a look at what their predictive life expectancy is going to be.
Based on where we live today, we could expect to live a certain amount of time, in some cases, a decade different than our neighbors 25 minutes away from where we live today.
Well, and any product or service you innovate and develop has to be grounded and centered on that human experience, or your end user, or whoever's going to benefit from that product.
What you are suggesting is transformative, saying, yeah, I know my incentive systems are very short term, but if you want to build something for the long term, if you want to build something that's impactful, that will not only impact this generation, for generations to come, it's about building trust first.
Innovation moves at the speed of trust because people support what they create. So you have to come and do something to the community. You have to come and do it with the community and for the community, and capture those community voices to guide any community development or transformation work.
I am so excited for everyone to listen to this conversation with Tomás León. We talked about not only the project that they've been working on with the zip code exam, but more importantly, why it's important that in this era of data and technology everywhere, how democratizing information is so important to drive change in community. Enjoy this episode with Tomás León. Welcome back to the Future Human Experience podcast. I'm your host, Eric Rodriguez. I am so excited for this episode because I not only have a fellow friend, a mentor in the community, a leader in the community, Tomás León, President and CEO of Equality Health Foundation. Bienvenido at the Future Human Experience.
Muchísimas gracias. It is an honor to be here. I've been watching your podcast. So excited to finally get an opportunity to come on and have a conversation.
Yes, Tomás. Well, again, we're so excited to have you here, but also excited to have a conversation about the great work that the foundation has been leading, Equality Health has been leading over the last few months, and that you're starting a movement about how you're using data to drive not only insights and in awareness, but more importantly, action when it comes to our healthcare services, healthcare awareness. Can you tell us a little bit more about the zip code exam project that y'all initiated just not too long ago?
Yeah, we're super excited about the zip code exam project. We partnered with a healthcare ad agency out of New York, Area 23. It's an IPG health company. Yeah. And they approached me a couple years ago about this cool concept, the zip code exam concept. And so at that time, we were engaging in our work in South Central Phoenix to address the disparity, life expectancy disparity gap that exists between South Phoenix and North Scottsdale, which is 14 years. And quality of life issues and health issues. And so we did a lot of learning there. And so we married that experience with this zip code exam project idea. And we created this interactive online platform to democratize data and put powerful data into the hands of people so they understand what their life expectancy is. But more importantly, what are the invisible forces or the root cause factors that are contributing to a shortened life expectancy or poor quality of life.
So let's just break this down then, Tomas. So what I love about, and I've had a chance to be in the platform, of course, we'll link up to that platform on the show notes here for this episode so our audience can go and experience that on their own. But what I found fascinating about this that you are telling us, or what this data was telling us, is that based on where we live today, based on the research that we have around that community, we could expect to live a certain amount of time, in some cases, a decade different than our neighbors, maybe just 25 minutes away from where we live today. Absolutely. Is that kind of what some of those key insights that you were finding when y'all were doing these type of exercises around bringing up this data to life?
Absolutely. And we're created a platform so 30,000 zip codes across the country can enter their zip code and take a look at what their predictive life expectancy is going to be, and then the factors that are influencing that. And I'll talk a little bit more about that. But that was the whole idea, is to aggregate publicly available data into a platform and help people understand how their zip code, your address, is a greater determinant of your life expectancy and in some cases your health outcomes and your quality of life. Yeah. And so your zip code is a greater determinant of your health outcomes, your quality of life and longevity of life than your genetic code.
Wow.
And so that surprises
Yeah.
people in many ways. Sometimes
Say.
people get upset, they get angry,
Claro.
they're intrigued. It inspires action at a grassroots level, or at a community level, or at a family level,
Say.
or an individual level.
Yeah. Yeah.
And so, and that's what we wanted to do. We wanted to put data, powerful data, into the hands of every American in 38,000 zip codes to spark change.
Yes.
Awareness and change.
Yeah. No, and Tomas, and it reminds me of an experience that I personally had through an organization called Valley Leadership. One of the exercises they encouraged us to do was to travel around the city and do a zip code, basically analysis. We didn't go necessarily strictly through healthcare, but we'll talk about the different factors, of course. And I remember it was my homework that I had to do for the month. And so with my wife, we talked about it. I said, why don't we take the kids? Why don't we go with the kids on a Sunday and let's drive around the Phoenix area. Let's go through these different zip codes.
Oh, I love that.
And let's have a conversation about what we see.
That's great.
And that experience. And it was interesting to see the world through their lenses, right? Because there were some things that they saw that I did not see, right? They're like, Dad, where's the shade here? Or why is that sidewalk different than this other sidewalk? Or Dad, I haven't seen the school yet. And I'm like, you're right, mijo. We've been here at least here for 15 minutes. I still haven't seen the school that's serving this community.
Right.
And so just seeing some of those different aspects of again, our neighbors, right? These are communities that we all share a lot of resources around and that we serve in our communities. We have very different lived experiences. And what I love that this project has done, especially in this era that we can say that we're overwhelmed with information, we're overwhelmed with data. Y'all have found a way to translate that data and make it relatable to our community. So easy as putting my zip code or my neighbor's zip code or my parents' zip code or where I grew up as well, right? And just going and looking at the historical data, for me, it was a wonderful experience to go into that platform. Tomas, I'm really excited for our audience to go into it. But also, what is the vision that y'all have with this type of work? Now that you have developed this platform, what are some of the things that y'all have planned not only to do in the near future, but going forward as you're activating these communities with this democratizing of data?
Yeah, well, again, the blueprint was started in South Central Phoenix with, our Wellbeing transformation initiative and assessing well-being and the impact analysis and the gaps and the strengths and talking with a lot of different residents and community leaders. And so it's important that to make a note that the data is important. So we've created a way for us to be able to aggregate a lot of publicly available data into a platform and a framework, and identified 5 key areas. And they're probably not all of the areas that impact people's health and well-being or the health of a community. And so basically this health assessment starts with your address, not a stethoscope that your doctor uses to check your heart. And so it allows us to create a community health report that can be shared with your family, with partners, with your elected officials. And so, and that's why we identified those 5 domains: access to healthcare, food availability or access to food or food insecurity, education levels, employment, as well as housing stability and walkability or your built environment. And so, and we, created a rating from 0 to 100, 100 means that, that's positive.
Yes.
And, closer to 0, you've got some disparities and some inequities and some challenges there that need to be addressed. And so, but it's important that, the data is not the whole story. So, like what you and your family did, you went around and did a tour and did your own visual assessment. You're, kind of trying to understand the lived experience of the people in that community, in that neighborhood. And that's what amplifies the data. It's, it goes back to the whole focus of your podcast is the human experience, right? So data without that human experience story, it's just data. Right. So you have to really illuminate the data with the lived experience of local residents and leaders in that community. And that's what's going to spark and change and champion change. And so again, you always have to mirror and combine the data with the human experience story, so you can fully understand what that community health report is saying.
And Tomas, so that's a great way of, maybe you've already answered this question, is like, so how do we in this era of constant data, but also how we navigate bias, right, in certain communities, and how we look at certain communities, how are we also, as we're elevating these data points and these stories, how are we making sure that we're also not diving into possible bias or historical bias that we have around one lived experience versus the other? What have been some of those aha moments that y'all have had, but also as you're driving this project, how we're making sure we're just not going into the bias standpoints of what data talks about?
Well, the local community and the residents will keep your feet on the ground, and they'll address those biases.
Love it.
And so we started this journey 2 years ago in South Central Phoenix after the pandemic, because we saw that the pandemic disproportionately impacted this community. And that was very diverse in terms of Black, Hispanic, Native American community in that area. And so we wanted to do our part to support the recovery and the healing, and improve the community conditions there that will improve quality of life and health. And so, we came in with a certain idea in terms of a model, a process, and a timeline. And so the community quickly gave me feedback, and said, "Hey, Tomas, we appreciate your interest, your support, but you got to understand the local community's perspective and the lived experience. And we move at the speed of trust. Innovation moves at the speed of trust, because if there's no local buy-in from what you're trying to champion in terms of change, people support what they create. So you have to, not come and do something to the community. You have to come and do it with the community and for the community, and capture those community voices to guide any community development or transformation work that happens. And so that's why it's important to pair, the data from this interactive platform with that human experience story to illuminate what the full story is. And then you move at the speed of trust in any community that you work in. So that was a big lesson learned and takeaway for me. I had learned long ago through community work that people support what they create. But when you're working with communities where there's decades of systemic, racism, discrimination, barriers, and challenges, that it takes a lot of trust with local community to start facilitating and supporting a transformation in communities.
That's a great example, Tomas. I mean, not only that innovation moves at the speed of trust, but sometimes because we live in this era of constant change and the slowest speed of change where we're going to feel is today, and there's a new headline every other day, there's a new AI coming out tomorrow or what have you, and we always feel that we're left behind. And our incentive systems are also guiding us to say, I need results today. What you are suggesting is transformative, is saying, I know my incentive systems are very short term, but if you want to build something for the long term, if you want to build something that's impactful, that will not only impact this generation, for generations to come, you have to move at the speed of trust. And that takes time. And I love that not only you were open enough, that your organization was open enough to listen, because sometimes when we have a great plan and we say we're funding this because that is what we're going to do, and we have this great five pillar plan that we're going to go implement, y'all were vulnerable enough to say, okay, wait, let me listen, right? Because you could have also said, I know that's what you want, community, but we know better than you. And y'all were vulnerable enough to say, hey, you know what? I need to pause this and let me listen, because I'm here for the long term, not just for the headline tomorrow. And that is a wonderful lesson, but I think it's a wonderful lesson for our audience that they could implement in any industry that they're in, that if they're obsessed with innovation, obsessed with change, obsessed with doing the best and for our communities and for our workplaces, it's about building trust first, and that is how you innovate.
Well, and any product or service you innovate and develop has to be grounded and centered on that human experience, or your end user, or whoever's going to benefit from that product. In our case, it's human-centric and community-based, community-centered strategies and approaches. Wow. We work in communities across 5 states: Arizona, Texas, Tennessee, Louisiana, Virginia, and mostly in communities where they're experiencing a 14 to 17-year life expectancy disparity gap, and other chronic conditions and quality of life issues. And so, this work is all centered on trust, and it's a long-term strategy, long-term work that we're doing important to have early wins.
So glad.
And so, the zip code exam interactive platform is a quick way to put immediate data into the hands of people, to spark conversation, to build awareness. But the change is going to happen when you bring the local community together, whether it's an alliance or a coalition or a partnership, to start addressing those issues and using the data to champion change and to measure progress over a period of time. But technology and AI and innovation is going to play an important role in all of what we do. But certainly, I'm excited about the possibilities in terms of what's next for the zip code exam project.
That is a great example. So, Tomas, this is, we've dove in over the last few minutes about the project, about the impact, about the future. Now let's talk about a little bit more about you. Like, what has been your inspiration to dive into this important work? What is the Tomás León anchor that brought you into this space? Because again, we've had a chance to know each other for the last couple of years, and I feel like every time we have a chance to talk, I learn a little more about your story. But share with us a little bit more about what has driven your inspiration to be not only committed to this mission, but inspire others to follow what this could do for the next generation as well.
Eric, I appreciate that question because I think everybody's story is important, and it illuminates why they're passionate about the things that they're doing. And so for me, what drives my passion, what drives my purpose in life is my humble beginnings. So I grew up in humble beginnings in a barrio Hollywood in the west side of Tucson, Arizona. There was my parents and my siblings, 8 of us in a 800 square foot house in the barrio, and living on the margin, just trying to make ends meet. So doing this work, I stay grounded in where I came from and that lived experience. So I know what it is to be hungry. I know what it is to, get access to a food box and try to figure out what do I do with that stuff in the food box. Get access to healthcare, housing stability. And so my mother, I was grateful because my parents were hardworking, blue collared, parents, faith driven, and, they created protective factors for us in terms of our faith and family and socially connecting with neighbors and family and friends. And fortunately, my mother was a nutrition educator in the community. So she always made sure that we were eating healthy and the best we could, especially trying to figure out what to do with the items in the food box, right? Because they weren't like culturally appropriate for us. But we were all athletes too. So softball players, baseball players. And so we, stayed physically fit. And so even though we were living in a tough, challenging environment, my parents were wise enough to create some protective factors for us. And so that lived experience fuels my passion and my purpose in life to try to create a level playing field of fair access and equitable access to the resources people need to achieve optimal health and well-being. And so our mission at Equality Health Foundation, which ties to my purpose in life and my personal passion, is leveling the playing field and creating greater access to the resources that people need to be able to achieve optimal health and well-being. And inspired by a bigger vision, which aligns with my purpose in life, which is, this is what I believe, and this is what Equality Health Foundation believes. We believe in an inclusive society of healthy communities where every person, you, I, your family, our neighbors, our loved ones, our coworkers, can achieve optimal health and well-being because they have fair and equitable access to the resources they need.
Wonderful.
And I believe we can achieve that in America to create a healthy society where we do remove the barriers and level the playing field. And so for me, that drives me, that drives my passion and inspires me day in and day out. But it's important that I don't lose sight of where I came from and keep my roots grounded in my humble beginning.
Yeah. Tomas, thank you so much for sharing your story. And one thing that resonated with me and in your story is that you're focused on removing barriers. And that sometimes when we talk about equality or equity or inclusive environments, when we don't see ourselves represented in those stories, we think that they're either bringing us down to have this experience. And that's not what we're trying to do. We're trying to remove the barriers to bring others up. right? And I love how you made sure we focused on that. So as part of making a more equitable experience for not only the current generation, next generation, is about making those invincible problems visible now, right? So we could create these solvable solutions. What have you learned on this journey, Tomas, that you have spanned in different walks of life in your career? And of course, you could learn about Tomas's career. I will link up to his LinkedIn. But you've been in all these different segments that have been in this work to a certain extent. Today it's healthcare, but you've been in this work on making these invincible problems a little bit more visible. What have you learned on this journey on making sure that we could do this not only today, but making sure that it's making impact for the future as well?
Yeah, that's an excellent question, because part of my focus has been driving equity and inclusion in everything I did in business and philanthropy and angel and venture capital investing and community health, and now community well-being. And so it's work that is not done alone. And so that's why at Quality Health Foundation we focus on bringing together public-private partners to facilitate and champion transformational change in the community. And so that's where the power is at. So
beautiful.
So the data is creating equity and access to important data, so people can understand what their community health report says about their community and where they're living at, and putting powerful data into the hands of people so they can do something with it. And then we're building out, pointing people to resources and solutions that can help support their grassroots change action that's taking place. And so leveling the playing field and creating greater access to the information, to potential solutions, and supporting that transformation, that's what drives the equity work that I do. But you got to be inclusive in how you do that. People have to be at the table where the assessment is done, ideas are generated, resources are allocated, strategies are implemented. And so that's where you get that buy-in and that long-term transformational effect that takes place in the community.
Tomas, real quick on that, I would love to just dive into the table perspective, right? Sometimes when we say we want everyone on the table, we think it's this Herculean effort sometimes to bring every single person to the table. Do you think it today in 2025 and 21st century that we're all connected, is it easier or harder to bring people to the table in your experience, right? That you've been doing this work. What has been your experience on making sure we're bringing everyone to the table? Is it easier today, or is it harder, or is it pretty much the same challenges that you always had to navigate to make sure everyone is represented on the table?
I think it's easy and hard.
Okay.
Because there's no substitute to sitting down eyeball to eyeball, like we're having this conversation today, connecting and different ways in that human level interaction. And so for us, when we're doing community work, we have to be in community, meeting with people in person. But technology is also an enabler. So we can't solely just use technological tools to facilitate type of connection, because you can have connections with people through technology, but you may not know one thing about that person. And so it's important to understand the limitations of technology and keep it human-centric, community-centric, so that you're continuing to build that relationship and understanding of the people that you're working with, or you're working for, or you're working to support. And so I think it could be a powerful combination of the two. And AI and technology innovation is going to continue to play a big role in how we improve health innovation, our healthcare system, community well-being. And so
is that where y'all seen AI play in this space that you're building out this project, Tomas? Have y'all considered the role that AI is going to play in the future?
We are. It's super exciting to envision all the possibilities, right? So not just for our zip code exam interactive platform, but just AI and technology innovation in general in the healthcare delivery space or the community well-being work. And so, but just AI can play so many different roles. Just imagine on the predictive models that can be generated when you're looking at predicting outcomes around diabetes or hospital admissions or mental health crises and other challenges. And so it can, helping you understand and predicting the target populations that are most at risk, or the neighborhoods and communities that are most at risk. And then also being able to help you track your intervention effectiveness over a period of time. And then even integrating, AI with electronic health record systems and clinical data. So when you're looking at whole person care or whole person work that you're doing, you're trying to impact all of what is influencing that person's health and well-being or their health outcomes. So AI could play a significant role in bringing together the social determinants of health data with clinical data to create whole person care models.
Wow. Which is very different how we've approached healthcare historically.
Right. I mean, it's been a sick care system instead of a well care, and looking in the rearview mirror instead of predicting what's to come next and how do we get ahead of it? How do we work upstream? How do we address the root cause issues that what I call our hidden cost drivers?
Yes.
So if you look at a pie chart, 20% of what impacts your health and well-being and your family and mine and my family has to do with access to health insurance coverage and access to quality care. 80% or more are all these root cause issues, the social determinants of health. Those are the hidden cost drivers in healthcare. So when people don't have access to healthy foods or transportation, education, employment, you're living in a trauma environment. It's not a safe environment to walk, hike, jog, run, or convene in your community. All of those factors are going to shorten your life expectancy, impact your health outcomes and your quality of life. And so we have to continue to look for ways for AI and technology innovation to be more predictive and be more targeted in the intervention and more efficient so that we can get better outcomes, lower cost in healthcare, and improve the health of the population or a neighborhood or an entire nation. For that
Absolutely. Yeah. So Tomas, just give us a quick, there's a lot of excitement around where y'all could go with AI. Share with us, if we were to say, hey, what is the 2 or 3 lines about where you see the possibilities of AI? What does that look like?
Well, imagine if Equality Health Foundation wanted to address diabetes in a underserved community. AI can help us analyze zip code level data around food access, income, and education. We can predict the target populations in a specific area, a neighborhood, or a zip code that is most at risk. And then we can recommend culturally tailored interventions to be able to have a desired effect and outcome there. And then we can monitor, doing time series analysis over a period of time, how community health has been changed and improved with the programs that have been implemented. And so that could be the power of AI. So not just putting powerful data into the hands of people, but enabling transformational change in the community to address those root cause issues.
In action, Well, Tomas, this has been a fascinating conversation. I'm so excited for people to not only learn more about this project, but continue to expand on it as well, right? Because I think that's the other thing too, that this conversation has told us that when we bring our community together in this work, we're able to not only elevate these stories, but elevate the work that needs to happen in the action. So thank you for that. Thank you for your leadership on that.
My pleasure.
With that said, Tomas, we always try to do something fun with our guests. I asked them to bring a surprise question for me. We've known each other for the last couple of years, so I'm really interested to see what you have in mind today and something that you're curious about me or about my work.
Well, it's been fascinating to watch your journey, and I so appreciate you bringing me on to be part of this conversation. And I've had a chance to watch a lot of your podcast interviews. So my surprise question is, what has surprised you about all the interviews you've done with these incredible leaders and change makers that have been having these conversations with you?
Oh my God, thank you, Tomas. What has surprised me, I think where these conversations go. I mean, again, behind the scenes type of insight for everyone that's listening. We have an idea where we're going to go with these conversations, but we always have these moments, right? These moments that kind of just take us back Today, for me, innovation moves at the speed of trust. That's just going to stick with me. We have a couple other guests that we're recording with. I'm sure we're going to have these moments, but I always go back to these moments that stick with me with different guests, and they become these anchors that I always go back to. But I always go back to as a validation for this work. One of the things I personally struggled with when I decided to go and do this was, can I do this on my own?
Right.
And even though thinking I'm doing this on my own, it's not. It's a platform to bring others as well, right? So either if I'm doing a keynote, I'm telling the stories either of my grandmother or my family or my communities. If I'm doing a podcast, I'm bringing the stories of Equality Health or the companies that different organizations are leading or their story to life. And so that has been something that has been surprising for me, that I really thought this was a solo job as a solopreneur, but it's not. It's a job that you bring so many others along. And I think that's been the most rewarding experience as well in doing this work, that it gives me an opportunity to elevate other people's stories, not just mine. And if mine can be an inspiration for others, because we're bringing these others along, then that's a little dent in the world that I have an opportunity to do.
Well, Eric, it's an inspiration to me and to many other people. You're bringing this community of change makers and leaders together that are working to make this world a better place. And awesome. I appreciate that.
Thank you, Tomas. Again, we will have the link to your information on the show notes. Tomas, thank you again for being part of the Future Human Experience podcast.
It's my pleasure and honor.
Thank you.
Thank you.
Thank you for listening to this episode. I'm inspired to hear that these conversations are resonating within our communities, our organizations, our companies, and our households all around the world. If you found this conversation to be valuable, please take the time to like, subscribe, and share it with someone else. I do believe that as the future gets much more digitized, it gives us an opportunity to be much more human as well. And these conversations are part of that journey. So if you're enjoying the content on this channel, please check out these videos. Thank you.